So this little video is on lower cross syndrome. It's a very common problem that we see, especially in people who have pre-existing back conditions or have sports-related injuries that involve their back, hips, etc. Again, the two primary reasons people have pain in the spine when it's mechanical in nature has got to do with flexibility or loss thereof and instability. Which basically means that there's imbalance in the muscles, that they're not firing like they're supposed to, or they're not working like they're supposed to. And some of that has to do with long-standing structural imbalances in the body, postural offsets, doing the same mechanical thing over and over again that causes disruption in how the neural system is perceiving information, and then it alters that information to the muscles to accommodate for the offsets or the imbalances. And then we have an actual syndrome that we call lower cross syndrome. So what I'm going to do is demonstrate what that would look like or what it means. Effectively what it means is if you look at your body as a cross going this way and this way, what we find is that the muscles that bring your leg up, we call those the hip flexors, are chronically tight. So the second part of that cross is your lower back muscles, which are also chronically tight. And then we have the other part of the cross, which is going this way, which is your butt muscles or your gluteal muscles and your belly muscles. And those are chronically inhibited or weak. So there's ways we test for that and things we look for. So what I'm going to just do is show you what it would look like on a patient. I'm going to play the patient for a moment, and then I'm going to swap it around and just show you what it actually looks like on a person and how we might go about correcting it. So first thing I'm going to do is I'm going to lay down for a second and I'm going to show you what that looks like when we're testing. So one of the first things what we look for is flexibility in the pelvis by having a person bring their leg up to the chest, or for that matter, us bringing that up to their chest. So we usually bring that all the way up, and as you can see in me, my leg stays perfectly flat. That's normal. Now in a person with a problem in that hip flexor, this is what we'd see. We literally see the leg rise, indicating that the hip cannot extend when we pull the other leg up, creating a backward movement of the pelvis, because the musculature that controls this motion is so tight, it won't allow for that. So that's the first thing we see. The second thing we're going to look for, again, is the inhibition in the muscles here. So we have people do a number of things, one of which is just have them do a quarter sit-up. Usually we're holding their feet, they're doing a quarter sit-up, we see how long they can hold that motion for. Most people that have a problem, within about 10 seconds, they're actually kind of shaking, and less than 30 seconds they have to lay down because they can't hold the position. So that tells me there's inhibition in the abdominal wall. That's the first thing. The second thing we do is we turn them over, and again, the back muscles here, when we've already checked this, they may not be able to go very far because they might be tight. That sitting motion, when we have them sit like this, have them go forward and try to touch their toes. If they can't do that and the chest doesn't hit their knees, that's a sign of tightness in the back muscles. The other thing, of course, is that I as a doctor, am feeling those and looking for how they feel. Do they feel tight? Do they feel loose? And then the last thing we're looking for is strength in the butt muscles, and functional movements. So the normal situation is with a person lying on their stomach, we just have them lift a leg, and when they do that, there should be no motion in the hips other than extension in the hip. There should be no turning in the spine. There should be no increase in the curve angle here. It should stay pretty stable, as mine is. And we have them do that both sides. So it's kind of like a marching test. You're having a march, boom, boom, boom. What we see in most people that have this problem is that when they go to elevate the leg, they can't use this muscle as well. So what we see them do is that. They start to use their low back and they turn. And they rotate the pelvis. So what you can do is imagine that with every step they're taking, there's going to be excess turn or twist that's happening in their spine. And you can imagine over a course of years, months, or what have you, that would cause a significant problem in their low back. So we're going to stop the video for a moment, and then I'm going to show you what it looks like on somebody.